Welcome, and thank you for joining this roundtable on healthy food landscapes, which is held against the backdrop of the UN General Assembly and the UN Food Systems Summit, which will be held tomorrow in New York and around the world. My name is Niels Lund. I'm a global lead for City Change Diabetes, a public-private partnership of 39 cities around the world, trying to work to defeat diabetes and obesity. And I'm also head of prevention and health promotion at Novo Nordisk. First, let me extend a special thank you to the Permanent Missions of Colombia and Denmark, to the UN for hosting the roundtable, and to Gehl for partnering on this important topic. I think we have a couple of exciting hours ahead of us, so I'll soon get out of the way, but let me just have a few words of housekeeping. This roundtable will be recorded, so everyone can watch it again afterwards, and the ones who didn't attend can also see it. But you can also engage in the debate throughout the roundtable by clicking the little question mark to the right on your screen. Click the question mark, a box opens, and then you can type in your question. If we do not get to your questions, we will try to respond to them afterwards. But now, without further ado, I would like to introduce our moderator of the day, Judith Cust, who is head of Madkulturen, a food knowledge hub in Denmark. Over to you, Judith.
Thank you ever so much, and thank you very much for letting me chair this very, very important roundtable today. As Mr. Lund says, this is at the backdrop of this very important summit, and to me it's so important that we get food so high up on the international agenda. And I very, very much look forward to a couple of hours together with you in exploring healthy food landscapes. Few words about myself. My name is Judith Quist, and I have a background in geography, environment development, and worked for many, many years for the fair trade movement, both in Denmark and internationally. Today, I am the CEO of the Danish institution, Madkulturen, which is a food cultural organization that we have here in Denmark. And I'll give you a few more words about if I can get this slide to work, that is. There we are, I think. There we are. I'll give you a few more words about this institution and why we exist in Denmark and why it's so unique. We've existed since 2011 with this agenda to strengthen food and cooking culture in Denmark. This is an acknowledgement of the fact that we need to understand our food culture to move forward some of these very important agendas on sustainability, on health, and other social agendas. And we do so by actually being established by the Ministry of Food and also then making public-private partnerships and in so doing creating new solutions to many of the problems that we see today. Food culture is a very, very big part of solution to some large-scale problems. For instance, climate change, 27% of the reduction that we can make here in our country, that potential reduction comes actually from our food system. In our population in Denmark, many recognize the need to change our eating habits, both to strengthen our health, but also to reduce carbon emission. But 1 in 4 find that their own eating habits are not compatible with climate-friendly diet. And I think that is going to be the root of many of the discussions that we're going to have. That changing habits is very difficult. Food culture is habits, traditions, everyday practices, education, skills, and taste. And so to understand and address food culture is essential in order to address these climate changes, address social issues, loneliness, and health inequalities. What we do in our institution is to base all of our projects, all of our partnerships on insights and knowledge. And some of the things that stand in our way and are the complex problems we're trying to address here in our country is, for instance, that meat is such a big part of the Danish food diet. 3 and 4 meals, evening meals, still are based around meat, and it's a very, very difficult cultural things to change. So some of our projects are trying to address how do we change the super tanker, as we call it, that the culture is towards something that is more plant-based. We also have, as in many countries, and that's one of the things that we're going to be addressing today, a rising prevalence of overweight among Danes. That's both amongst youngsters, but also amongst adults. And we have a huge problem with loneliness. It's actually more than 20% of Danes feel lonely and do not have anybody to share their everyday lives and meals with. So that's also a big social agenda that food can be a part of addressing. So here are just 3 examples, because we're soon going to move on to our keynote speakers, but just a few examples on how we work with these agendas here. One of our biggest projects group is amongst children and youth and teens. Because if we do not change their eating habits, if they do not get cooking skills, then we really do have dire problems in the future. One of our key project targets actually boarding schools for teens. 1 in 3 out of teens actually attend boarding schools. So this is a real good arena to address some of these issues through learnings in the kitchen, which we made a very, very big program around. We also have programs where we actually say, how do we, everyday citizen that go shopping, how are they going to be able to make better climate and health choices? And now we've made quite big programs on educating employees in supermarkets to be better climate ambassadors. And then to address the loneliness issue I told you about, and to try and work around that agenda, we make food community creating social changes. We have a very big project on one of our islands with 25 local associations where we qualify culinary agents to help to propagate a healthy and social food culture in actually a very rural area of our country. So this is just some example of why we're working at this and how we are tackling this issue in Denmark. Now I'd like to move on and actually have our 2 ministers today welcoming us with a welcome address. And we will start by welcoming the Minister of Agriculture and Rural Development of Colombia, Mr. Rodolfo Navarro-Sea. He's a Colombian economist who graduated from the University of Los Andes and in February 2020 was appointed by the President as the Minister of Agriculture. Here's a welcome.
Quiero agradecer al gobierno de Dinamarca por habernos invitado a ser coanfitriones en el evento Paisajes de Alimentos Saludables. Cómo la planificación urbana puede incentivar la alimentación saludable y reducir las emisiones de carbono, con el propósito de compartir ideas sobre análisis existentes sobre sistemas alimentarios y el valor de las acciones basadas en las comunidades. Un tema tan importante que nos permite, como líderes, en debatir y articular acciones a nivel mundial. Desde Colombia, consideramos muy relevante la transformación de los sistemas alimentarios, con miras a reducir el impacto negativo del cambio climático. Aún más ahora que estamos sobreviviendo una pandemia mundial. Quisiera centrar mi intervención en las acciones que han ayudado a Colombia a mejorar nuestros sistemas alimentarios. En primer lugar, la alineación nacional del gobierno colombiano en la política de seguridad alimentaria y nutrición. En segundo lugar, el compromiso con el sector privado para acelerar la aplicación de las políticas. Y por último, nuestra visión respecto a la transformación de los sistemas alimentarios. Sobre el primer punto, resalto que nuestra constitución política establece el derecho a la alimentación equilibrada como un derecho fundamental y el suministro y producción agrícola como deberes del Estado. Para lograr este mandato, en el 2009 se instauró la Comisión Intersectorial para la Seguridad Alimentaria y la Nutrición CISAN, para implementar los principales instrumentos de seguridad alimentaria y nutrición. Por su parte, el compromiso del sector privado para acelerar la implementación de políticas es determinante, ya que se puede tener el mejor marco institucional, pero si el sector privado no está comprometido, la estabilidad del sistema alimentario está en riesgo. En este sentido, nos enfocamos en la participación público-privada para garantizar una alimentación nutritiva y saludable, la inclusión económica y social, la eficacia en el uso de los recursos y la sostenibilidad del medio ambiente. En esta línea, contamos con iniciativas muy importantes, auspiciadas por el Foro Económico Mundial, WEF, como la Alianza de Acción Alimentaria en Colombia, con diferentes proyectos como AgroColombia, enfocado en traer sostenibilidad a la agricultura en Colombia. En muchos departamentos como el Cesar, Magdalena, Huila, entre otros. Para cadenas como el cacao, la palma de aceite, frutas, carne, también tenemos una gran alianza para la nutrición, iniciativa de la primera dama de la nación, la señora María Juliana Ruiz, que tiene como fin fortalecer las capacidades de diferentes actores institucionales y de la sociedad civil en Colombia, en la generación de ambientes alimentarios más saludables y sostenibles. Mi tercer punto es la visión que tenemos para el 2030, donde vamos en Colombia a ser un país en el que la seguridad alimentaria y nutricional estará garantizada por un marco institucional robusto, que permitirá la provisión estable y suficiente de alimentos para satisfacer las necesidades nutricionales de los colombianos y contribuir con otros países. Lo anterior, alineado con la meta del gobierno nacional, bajo el liderazgo del presidente Iván Duque, de reducir los gases de efecto invernadero en un 51% para el año 2030. Para finalizar mi intervención, quisiera hacerle una invitación para unirnos como países a fin de lograr materializar un solo objetivo colectivo: lograr la transformación de los sistemas alimentarios que propenden la seguridad alimentaria mundial sustentable, productiva y sostenible. También esperamos que los países con más capacidad adquisitiva le den prioridad a los países que están en el trópico para fortalecer estos sistemas alimentarios y la sostenibilidad para producir conservando y conservar produciendo. Contamos con los países desarrollados para que nuestras naciones puedan ser pioneras no solamente de la seguridad alimentaria, sino también de la sostenibilidad. De esa manera trabajamos en Colombia juntos por el campo.
Thank you ever so much to Mr. Navarro Sea for this welcoming address. Now we'll move on to a welcome remark from the Danish Minister of Food, Agriculture and Fishery, Rasmus Prehn. Rasmus Prehn has previously been the Minister of Development and Cooperation from 2019 and 2020 and is now the Minister of Food, Agriculture and Fishery. He's been a member of the Danish Parliament since 2005, and now we'd like to hear the welcoming address.
Thank you for inviting me to this important event to give this opening remark. We have to deliver on the Sustainable Development Goals, and we need to reflect on the true cost of our food systems. We must act to tackle the major challenges of our time, threatening both health and climate. And at the same time, we must confront diseases such as type 2 diabetes and cancer. One way to do this is to improve our eating habits by increasing awareness and motivation to eat differently. That is why we need to promote new food systems based on innovative approaches. Initiatives like Cities Changing Diabetes are important because they create partnerships and dialogue. The 30 partnerships you have created all over the world is an important step towards making a real difference. In Denmark, we have a strong tradition for partnerships and dialogue, as well as for sharing new technology and scientific evidence. We bring people together, talk to each other, and learn from each other. These are fundamental principles if you want to make a difference that will last. That is also why we approach improving our eating habits. In January this year, the Danish government launched the official Dietary Guidelines. They are good for both health and for climate. By following the guidelines, the risk of lifestyle diseases such as type 2 diabetes and cancer is reduced. More specifically, the Dietary Guidelines stress the importance of eating more vegetables, fruit, whole grain and nuts, foods that benefit health and at the same time have a low climate footprint. Our vision is that the majority of consumers enjoy nutritious meals in accordance with the Dietary Guidelines, to the benefit of both health and climate. In relation to the UN Food Systems Summit, Denmark supports the School Meals Coalition and will engage actively in the Healthy Diet Coalition, with a focus on healthy and sustainable dietary guidelines. I wish you all the best. Thank you.
Thank you ever so much to our two ministers from Colombia and Denmark, who I guess very much stress what this day is all about. We need to take action, we need to cooperate. And I guess these guidelines that the Danish minister talked about that tackles both health and climate at the same time is some of the things we're going to look at. By zooming in to looking at Foodscapes, existing Foodscapes analysis and the value of community-based action. And it's such a pleasure in that sense to invite Jeff Risen to be the keynote speaker. Jeff Risen serves as the lead designer working on an existing project to transform San Francisco's Market Street district into a vibrant and livable neighborhood for the future. He's the managing director of the legendary Danish architect firm Gehl Studio in the US. And we so much look forward to hear from you, Jeff. What is a foodscape, and why is it relevant to cities to study food in cities when defining public health actions, and what are the cornerstone of studying foodscapes? So over to you.
Wonderful. Pleasure to be here with you all. Can you see my screen? I can't see you. So
We can see you.
are we okay?
Yes.
Okay, wonderful. So as you mentioned, Judith, this is a question of creating healthy neighborhoods for all. And we at Gehl, as you mentioned, begin by tackling wicked problems like that by actually starting with everyday behavior and beginning to understand what drives people to do the things they do, and then hopefully shape conditions that allow everyone to thrive more. Traditionally, our practice at Gehl has been very much working with urban planners, with city planning departments, also with real estate developers. And over time, though, we've seen our work transition more to really also begin to engage with public health departments, international organizations like UNICEF, and we're very happy to be partnering with Novo and several other of the speakers on this call, cities around the world and different organizations, to bring sort of our expertise around cities into local health clinics or local NGOs. So really what our ambition is and what we think is sort of untapped potential is to connect public health to urban planning. And by doing so, we can really close the gap between the city and the individual. There's a lot of great programs and projects out there that operate at the national and city level. And then, of course, there's a lot of campaigns that also speak directly to individuals. What food should you eat or not? Should you walk rather than drive? And those key sort of cornerstones of strategies in cities are important, but we think there's actually a gap in the middle. And that's this neighborhood-based approach to the Foodscape that I'm going to talk a little bit more about today. And really what is important about this approach is that it allows us to address two of the most pressing issues in our societies today, both the health issues that you pointed out at the beginning, Judith, about loneliness, overweight, type 2 diabetes, whatever it might be, but also together with climate action. So by blending urban planning and public health, we can also blend together the health of individuals and the health of the planet. And if we focus on people's everyday behavior, well, now we're making it possible for the everyday mother, father, teen, whoever you might be, to actually make a positive impact rather than only waiting for large institutions and organizations to make change. So this idea of the Foodscape is really about moving from the sort of series of investments over time, where for many years the focus on health was very much on the individual. Now we see with this amazing summit that we're part of at the UN, the food system, thinking about the entire system in an integrated way. But I think we even need to evolve on that further and really bring that system down to real life experiences. So as experts, we can work with this complex and abstract system like the food system, but to really make a difference in everyday people's lives, we need to speak much more about those everyday experiences and the place where people interact with the food system. And that's really what this Foodscape is, right? So the Foodscape is the actual places, the supermarkets, the corner stores, the kiosks, the places that you buy and purchase food, cafes, whatever it might be, but also the life of the neighborhood. What comings and goings happen in and around that food place, and the shape of the environment there, the width of the street, the height of the buildings, the transparency of the ground floor. So these three elements together, that really becomes the shape, the environment in which we make our food choices and our food decisions. So using that approach, we've been working with some of the amazing people that you're here just after me in Bogota and Houston, but also in Philadelphia, Copenhagen, and London, to take this approach and apply it in very, very different contexts. And so what we'll do is talk a little bit more about the Philadelphia and Copenhagen case. So Philadelphia, especially the north part of Philadelphia, is a city that is a neighborhood, an area that has some real challenges. You have high unemployment, You have an incredible amount of people living below the poverty line, almost half, a young population, and actually a very diverse population, predominantly people of color, Black and Hispanic. So in this neighborhood, if you look at it from above, if you Google, food places, do an analysis sort of from your desktop, what you might see in this area is, a place with a plethora, or at least a variety of options for food. But when you get down at eye level and begin to talk to people, you understand that in this case, a majority of those dots on the map, well, they're actually connected to Temple University. They are catered and tailored to the diets and the needs of a very particular group of university students. And once you take those food places away, you see that this neighborhood actually has a much more limited food supply and food options. Again, as you zoom even more in and really look at the neighborhood from the perspective of the people that live there, you see even a lot of those places that are dots on the map that might provide goods and food for locals, well, they still don't provide, fresh food or healthy food. And that's a challenge that a lot of organizations and folks have been, struggling with really for decades. How do we bring better food options into low-income communities like this one? And what we see and what we're learning is that the demand is there. When we talk to locals on the ground, they mention how they can't get hold of fresh fruits and vegetables, and how they can't make some of the food that they would love to make, that their family really enjoys. So there's a supply and demand mismatch here that is not easy to overcome, but it's one that by speaking and gathering information directly with citizens, we've gained a lot of insight. One thing we learned is there are some great destinations in Philadelphia that already attract youth and young children and parents and families, and they're already safe, wonderful parks and playgrounds and places in this neighborhood, but there's no food there. So how might we simply begin to incorporate food options into the wonderful destinations that already exist in this community? And how do we begin to address some of the challenges and social desires that people have, like wanting to bring their grandkids to places in the city, make food for them with fresh fruits and vegetables? So what we have done based on this understanding, and together with the city of Philadelphia and an organization called Philabundance and Novo, begin to think about some pilot projects, some lightweight, quick to implement, affordable interventions that speak to some of the demand that we see from local residents, and begin to address some of the issues that are more institutional and systemic. One of those is around a mobile grocer, essentially. By spending time with the community, we learned the main routes that busy parents and families take every day. And if we could bring this mobile grocer along that route, intersecting with people's commuting patterns along the path to and from school, then it's not a question of needing to supply a supermarket with a permanent supply of better food, but we can actually spread that out to the entire community in a very targeted way, meeting them where they are, at Penrose Playground where they already spend time, at the local corner stores where maybe they're buying other things for their everyday needs, at the metro stop that otherwise couldn't support a full-service grocery store. So this is just one of 3 ideas that are now being unfolded together with the local community in Philadelphia to address this issue. And what is great, I love this quote by our collaborative partner there, Jay Foster. Even though they had been working in this community for many years, this approach, this way of looking at the city, really allowed them to gain better insights and thus better serve their neighbors in need. And this idea of a community foodscape asset map is something that they're going to be continuing to work with in the future. Now, another situation, if we shift to Copenhagen, obviously a very different environment than Philadelphia, but one still with significant challenges that Judith laid out. Here we see that this approach still works, right? So this idea of mapping food places, looking at a neighborhood from eye level, observing behaviors, speaking with locals, that's super important in Philadelphia, and it's also really important in Copenhagen. And we can gain unique insights that really tune us in to what the differences or similarities are to different places by using the same set of methods and tools. And this sort of set of tools is really something that we call the Gehl lens. But the idea is how do you have a new set of glasses, of tools to essentially blend together urban planning and public health, blend together things like the lived experience of individuals together with these big systemic challenges involved in the food system. And what this Gehl lens does is it's a combination of some digital methods. So equipping community researchers, folks that live and work in a particular location, equipping them with some apps and some digital tools that allow them to document what's going on. And then it's also, very analog, down-to-earth approaches about putting up posters, sticky notes out in community centers, out at schools, and again, getting more qualitative information together with some of that digital data. So what this looks like in Copenhagen is, spending time with youth, with 12 to 16-year-olds, hanging out in their neighborhood before and after school, finding out what their sort of day really looks like. And one of the key findings that we found here, in this case in Copenhagen, was these young kids, they go to the supermarket 2 or 3 times a day, sometimes in the same group of friends, sometimes alone, in different constellations. And we could see that path of essentially going from school to supermarket, as you see here, where we could intercept them. We could make interventions along that daily path with some new food options, essentially. So what we started to do is think about, well, can we make new seeding and planting? Can we integrate a food truck, new public space? Can we collaborate with local supermarkets? And what we found is, of course, well, whenever you talk to people and the kids themselves, they talk a lot about affordability and taste of being very important. But as we spent more and more time with these kids, we learned that, yes, affordability and taste were part of it, but there's actually a whole quality sort of checklist that we could use to create the food environments that kids want to spend time in. And what we learned is that, you might remember yourself when you're a teenager, is that you're a teenager first, right? You want to be with your friends. You want to be social. And if we can provide a condition with safe destinations that are in walking distance from home and school, that provide access and shelter, that are fun and colorful, that give kids a chance to be spontaneous, and where they can also be together, where one person buys something, another person brings their own lunch. Well, those other elements really create the key ingredients together with taste and affordability. So using this checklist that we gleaned from talking with youth, we put together a multi-pronged campaign, essentially, with new food trucks, with supermarket partnerships, and with new public space to create the ideal environment for introducing youth to essentially new food behaviors and beginning to shift that diet. So these lightweight, relatively easy to implement pilots were then implemented over a 6-week period. And simultaneously, we then gathered data. What's happening? Who's spending time there? Are the kids actually eating the food? Are they interacting in the public space? What's working and what's not? And of these 3 options, in this case, we found that the food trucks were most effective at engaging youth. We were able to see that in these locations, we'd have up to 450 youth and people a day interacting with the food truck and the supermarket. And we could imagine that, hey, if during this pilot project, if we were able to get that many people a day for 6 weeks, we would actually make a huge impact on carbon emissions just from this one little project. and began to also say to think about, well, carbon's great, but what if those 450 kids ate just one meal that was more nutritionally balanced? And what if those same kids maybe ate one less meal of processed food or other less healthy food options? And what if we actually introduced those 450 kids to a habit that they began to not only use this one day, but throughout the rest of their week and throughout the rest of their life, actually. So this idea of starting small, but monitoring what impact you're having, learning from it, and then thinking about how you can begin to scale up is really the frame of mind that's tied together with this Foodscape approach. Thinking top down and bottom up simultaneously. This really is a question of thinking hyper-local and moving up from these individual interventions that I'm talking about to think about how they might be interacting more with the neighborhood. And then as we continue to measure impact and share information with different city partners, they could begin to influence citywide planning policy and even large-scale projects around the city. So this slower yet important change that we call policy, we can't get it overnight, especially with something as complex as food systems. But we can begin to build and push and momentum in that direction through these fast implementable projects. And again, you think, well, it's just one project, right? 450 kids, whatever. But taking this approach and scaling it all over Denmark, well, if we have 450 kids in 1,000 locations, now we're really having a major impact on not only their health, but also CO2 emissions. So really, that's where I want to leave my portion of the conversation and turn it over to the rest of the experts here. But I'll just leave you with sort of 3 thoughts that are very explicit about what you can do as an individual and in your organization. Remember to engage directly with the people whose lives you hope to improve. And it sounds kind of obvious when you say it, but we're finding that there's so many communities, so many teams, so many groups that have actually never been asked, what do they want to see in their neighborhood? What is their everyday routine? So we can use a combination of tools and methods to directly engage with local folks in a really meaningful way. Now, we do know that in a lot of places, especially vulnerable communities, are engaged with all the time. They answer questionnaires and they go to workshops. And we have to make good on that engagement. We have to be able to build trust and show good faith by not only engaging the community, but also bringing tangible interventions, tangible change to these locations so that kids, parents, stakeholders can see, oh, when I made that workshop with you, and I spent time telling you the things I'm expert in, you used it for this specific intervention. I can't express how important this is. Communities do not need any more reports or data. As experts, we can use those reports to then bring tangible improvements to communities. And if we're going to engage them, we have to be able to make good on that engagement. And the final thing is interventions are hard, right? Engagement's actually easy. But putting things on the ground, that's a real challenge. That requires creative partnerships, that requires real money, that requires a form of collaboration between public, private, and philanthropic organizations that we don't always see in this food system space. So that means directly engaging with organizations like McDonald's, who do a wonderful job to actually invite youth and teens into their stores. What can we learn from them? It means also directly engaging with transportation departments and other city agencies, because actually bus stops are a place that youth tend to spend a lot of time. So how do we nudge their food choices while they might be waiting for the bus or public transit? So these are just hopefully 3 concrete action items within this frame of the Foodscape. And I hope that you can take some of that with you and continue to be inspired by the other presentations that we're going to have today. Thank you.
Thank you ever so much, Jeff. That was extremely inspiring and a very, very valuable kickoff to this roundtable. We've now heard from two ministers and your keynote on creating healthy foodscapes. And already during the first interventions, we have several comments and questions that are submitted. And you can still do so, that's very important to say, by clicking on the question mark on the right of your screen. We'll try and address some of these questions. We are a little bit behind on times, but I will still allow for a few questions. And I will kick off with the first one, which is perhaps not surprisingly touching upon the COVID pandemic. It's hard not to do so. And Jeff, I'd like to hear what you think as the world is still struggling to deal with the effects of this pandemic. What are your reflections on how we are creating healthier foodscapes as an element in building back better right now in the situation we have globally?
Yeah, well, we all know that the most vulnerable communities before COVID continue to be not only the hardest hit through the pandemic, but also, really having the biggest challenges to bounce back. So there's a lot of goodwill out there from federal government, from organizations like the UN, like Novo, et cetera. So there's I think, an opportunity to really focus on the communities that have been especially hard hit and leverage some of the funding that's available to really begin to make big impacts in these locations. So in that way, I think that we could truly build back better if we commit ourselves to the most vulnerable folks and begin to start our efforts there, and then gain some momentum where we can continue to work with other populations.
And do you feel that commitment is out there right now?
You know what? I feel the commitment is there. I feel like there's some tools that are missing. I feel like this is new, right? Urban planning agencies haven't worked specifically with food systems, and public health folks aren't used to directly engaging with the physical environment. So this, again, so much innovation has been spurred by COVID, and I think this is another example where it's a time to innovate. The goodwill is there, but now we really need to take advantage in the next 6 months, a year and a half, to begin to show some progress and learn how to bridge the gap between these different disciplines and different city agencies, different organizations.
That makes a lot of sense. I'll just allow for another questions. What would your biggest wish be to the outcome of this UN Food System Summit?
Yeah, great. I would love, I'd love to see the UN or the other organizations a part of this commit to a budget going to projects that increase food access. Commit to a budget of projects that, decrease the number of people with living in at-risk food neighborhoods. I'd like to see concrete money committed at the local level to do projects so that we could measure. I'd like to see the UN sort of put their, or the folks here put their money where their mouth is, to say to the extent where they say not only are we going to commit a budget, but we're going to set some goals, some KPIs related to how many people we're going to impact, the number of loneliness levels we want to bring down, the number of obese children levels we want to bring down. So I know some of these targets already exist, but I'd like to see them brought down at the local level and actual dollars committed to the projects that will really make a difference.
Great, that's a great answer. I think we all wish for that, and I think that goes very well in hand with what you're saying. The need to monitor and then to be able to scale up, and that of course is going to require a lot of commitment. Jeff, thank you ever so much. We're out of time for now, but thank you very, very much. We're now going to introduce a very strong panel of panelists. We have 4, and I'll just give you an introduction, and then we have a little presentation from each. First of all, we're going to welcome Dr. Sarah Valencia, who is the Director of Education and Research on Health at the Secretariat of Health in Bogota, in Colombia. And Sarah is a professional with experience in researching health, innovation policies, and the influence on biomedical health innovation in Latin America. And at the Secretariat of Health, she's responsible for managing the international cooperation strategies and for implementing the public initiative on research and education on health. So that's going to be our first panelist, and a very, very warm welcome to you, Sarah. And the second panelist is Dr. Andrea Cust. I hope I pronounced it right, otherwise put me right afterward, from the Hope Clinic. And for the last 13 years, Dr. Andrea has been the Chief Executive Officer of the Asian American Health Coalition, DBA Hope Clinic, a federally qualified health center serving the large Asian American community in Houston. And as a physician with a master's in public health, Dr. Cust has over 20 years of experience working with community health centers designing effective and innovative system of care. So also an extremely warm welcome to you. We'll then move on to our third panelist, which is partner Selva Gordogan. I hope again that I pronounce it halfway properly, from Superpool. And Selva Gordogan is a partner at Superpool and graduated from the SAIC USA as an architect. Selva was instrumental in establishing Superpool in Istanbul in 2006. And most recently, Superpool has taken on directing Studio X Istanbul, which is an urban laboratory founded by Columbia University. So also very, very warm welcome to you. Our last panelist is Senior Project Manager Sophie Quist from Norris, Scotland. Sophie is the Senior Project Officer at Food Justice Organisation Norris, Scotland, where she works on local food and climate policy and advocates for putting food system on the agenda at COP26. Sophie's background is actually in international human rights and environmental law, and she's a member of the Right to Food Research Cluster at the University of Edinburgh, and has previously worked with children's rights and human rights incorporation in Scotland. So as you can all hear, we have an extremely strong panelists here, and I'll move directly to you, Sarah Valencia, and give you time for your presentation.
So, good morning, good afternoon to everybody. My name is Sarah Valencia, and I'm going to present to you some of the actions for healthy eating that we have been implementing in Bogota. Also, this is the work of a team, not just here at the Secretariat of Health, but it's part of a public agenda that we work with different sectors, not just in Bogota, but also, as I'm going to mention in some parts of our presentation, it is an alliance also with the region that we call Bogota Metropolitan Region that looks to aim to overcome some of the challenges that we have for healthy eating in our city. So I'm just going to present some of the aspects that we have here for the food and nutrition insecurity in Bogota. So the National Survey on Nutrition in 2015 shows that Colombia, 54% of the households have food insecurity. And if we go to Bogota, the number changes between 2010 and 2015, increasing from 40.1% to 50.2%. So it is a very interesting and not the positive outcome that we were expecting in food insecurity. So this is something that we need to address. Also, when we are looking about malnutrition in children under 5 years of age, we can see that in our city, the trend has been decreasing over time. However, if we see in this last part of 2020, the percentage of people, children under 5 years that have malnutrition increased, and that this is because of the pandemic. So it is one of the challenges that we have to face as a city right now to overcome all these chronic diseases, but also the fact that pandemia has had on nutrition of children. And if we go to the children of population over 5 years old, we can see that the trends change. And according to the body mass index, children in 2020 increased the levels of weight, obesity, and overweight. So we can see here that in the 2020, the number of healthy body mass index for age decreased in this last year, and obesity also increased. Then it is something that we need to address, and it's a public issue. So what has been happening in Colombia? So some of the determinants that are changing our food intake and our habits can be classified in 3 different kinds: structural determinants, intermediary determinants, and individual determinants. As the key speaker mentioned before, we are facing right now the weather and climate change, and this is changing the way in which we are producing food and the food offered. Before, in our country, we had 2 very defined seasons: wet season, dry seasons. Farmers knew when they had to plant and grow their foods. Now it's less possible to do that prediction. So technology has to overcome part of these challenges that we have, and we need to work together. And that's something that we are discussing in this summit. Also, demographic changes in the population. Our population is aging. People producing food in the rural areas also are decreasing. So these demographic changes in the rural areas and also in the cities is changing the way that we are producing and consuming food. And also changes in the gender roles. Women are not working more at some places at home, are also the ones managing the food spendings and the economy. So this is part of the structural determinants. Also, we have intermediary determinants as social changes and politics in the territories. Also, territories consuming and demanding food, but also those that are producing food. And that is about a discussion that we have to take, how these 2 policies are going to work together to allow a healthy food system change. And also, people is changing how they consume food, how they're cooking. As there was mentioned before, the numbers of one person living in one household also has changed in the dynamics. And it's not just happening in Europe, also it's happening, and the last inform here in Latin America and Colombia. It shows that more people is living alone. So that changed the way in which people is nutrition themselves. So I'm going to show on to talk about the public policy for food and nutrition security that we have here in Bogota, that the aim is to be the food citizen between 2019 and 2031. And our main goal is to gradually overcome food insecurity and malnutrition in Bogota. And we have very specific objectives, as you will see, are related with those determinants that we mentioned before. So first of all, we want to progressively influence the situations of economic and social inequality that affects food and nutritional sovereignty in our city. Also consolidate the healthy food supply chain and a distribution system, including this dynamic between our region, because they are those producing mainly the food that we are consuming here in Bogota, and working quite closely with those areas and other municipalities, and also encourage responsible consumption of healthy food and healthy practices at all ages. As a city, we have a specific focus on children and ensure that they have a proper nutrition, but also we need to make sure that all citizens at all ages have a proper food and nutrition, because as we are working together with cities changing diabetes, also we are quite concerned about these chronic and metabolic diseases that we are experiencing in our city. So I'm going to discuss some of the actions that we have been implementing. So actions to identify vulnerable cases and link them to social programs. Also how we have been working on promoting healthy eating and breastfeeding. And 2 actions in which Gehl has been working quite close with us doing our work on food landscapes. I'm going to be dipping onto that results to improve the availability and consumption of healthy food and the creation of healthy environments. So also I need to mention that we have to create food citizenship. So this is not just the offer of the city and the creation of the spaces, is how we can empower people, because we understand they have an autonomy and an ability to define their food preferences, but also they have the right and truthful they have the right to receive truthful, sufficient, and understandable information that can influence and allow them to make more and better informed decisions. So this is something that we have to work to empower these citizens and give them the information. They have also the right to have sufficient and healthy food. We need to influence the private and public spheres also, and to allow people to participate in the food governance. So I'm going to tackle and to discuss more about the actions that we have been implemented. So in the case of the actions to reduce malnutrition in children under 5 years old, we are implementing individual actions. For example, integral attention of the roots of children under 5 years old with nutritional disorders. So once a social worker and nurse identify that a children has been deprived of healthy nutrition, they are encouraged to what we call healthy roots, to provide a specific nutrition and work and program to allow them to overcome the situation. Also, the implementation of the strategy child-friendly hospitals, and also we are implementing a core study of public health events related to children malnutrition, pregnant women, and newborns with low weight. So we expect on the long term, like means at the end of our term as a public government, we implemented to decrease to zero the mortality rate per 100,000 children under 5, also decrease to 15% the proportion of children under 5 of age with inadequate nutritional status, and also have more than 10 private hospitals with this strategy of child-friendly hospitals. Also, promotion of healthy eating and breastfeeding. So we are doing some collective actions that we are implementing, as I mentioned. So we are strengthening knowledge on breastfeeding to help professionals and pregnant women and adolescents. Also information and education and communication on food and nutrition security. Promotion of strategies for coping with food insecurity, self-consumption of food, and the creation and strengthening of social networks to support healthy eating with an emphasis on breastfeeding. And we need to emphasize that we are in a campaign to promote myths, to decrease myths about breastfeeding in the first place, and also the public stigma of breastfeeding, and how women at work and other public spaces can openly be breastfeeding and be comfortable with themselves in this process. So finally, we want to talk and share the experience that we have been doing with Gehl in Bogota. Has been amazing. We have been working since last year doing this research and implementing what was mentioned before as Gehl Lens to study some spaces in Bogota. We identify 4 neighborhoods that for us, they were food deserts. We were interested in to understand how people in those places were interacting with food, how was the food offered in those places, but also what strategies can be implemented there to overcome the barriers to access to healthy food. So some of the cases that, some of the challenges that we found here is that the landscape affected how people also interacted with the neighborhood shops that they have there. Also, the public realm is a bigger challenge to eating healthy and it's costly. Processed food dominates the stores and the visibility in the public realm, and the building topologies make food difficult to access. And here are two examples of two different neighborhoods. So one neighborhood is completely on the land part of the city, as you can see the first one. So this is very steepy and difficult to access to some parts of the neighborhood. Other ones are more different and have more offers there. Also, we have other challenges. As we can see, 3 out of 4 people cook and eat at home every day, but 25% of people eat in public space or transit. Also, 40% of people commute more than 60 minutes daily, so the time that they have also for shopping can be reduced. And we need to address how in these transport areas they can access to information, but also we can get closer to those places to offer a healthy food variety. And also 75% of the offer is processed and ultra processed foods there. And this is quite important because here we have a lot of public vendors, but the offer are frituras, deep fried food, for example, that is not that healthy. So the neighborhoods offer different food experiences. Also, the quality of food changes in the spaces, and people in the peripheries cook at home but struggle to get the produce because they don't have these kind of offers. And because of the pandemic, people used to go to work and nearby to the markets and plazas, they were getting the foods, and back home they were cooking. But because of the pandemic, they couldn't go and travel to very long distance places to get that. So that changed the dynamic, and the offer in the places also changed and was less, and the prices increased. So this is part of the reason why we were getting less people with children with less weight, but also children over 5 years old with obesity because the offer was not that healthy in the neighborhood. So finally, I'm going to present the 6 examples that people from Gehl proposed to use as an strategies to overcome the weakness that they identify in these food landscapes. So to create safety routes, create identity activities so people can identify new offers of food, also create food culture around these communities, also allocate food places nearby, also change the daily rhythms of access to food because people were arriving at home after 5 or 6 p.m. and the food offer was less, and also try to create delivery actions. So this first one, we are working with the Secretariat of Economic Development to do some farmers markets in those locations and offer more healthy diet there. Also, to create a healthy diet starts with you. This is an activity that we are creating with neighborhoods stores so they can tell to people how they can consume better food, and they can be the guides for these actions and to promote healthy culture. Also, we are creating this food culture and creating a regulatory framework to increase supply of natural foods, eliminating advertising of ultra-processed foods. And also, as I mentioned before, transport places are very important, and advertising at buses and the integrated mass transit system is very important to create that culture. And finally, we are working with food places, healthy neighborhood stewards, a strategy of the Secretariat to train neighborhood shopkeepers on nutrition topics that allow the promotion of healthy eating and dissemination within their customers. So here are some of the challenges, and my time is short now, that we have to overcome. So we need to sustain counseling actions in breastfeeding in infants. So this is one of the challenges, provide timely and integral attention to identify malnutrition cases, articulate interventions including the government, the family, and the society, influence social determinants on the exercise of motherhood and breastfeeding, keep working with healthcare providers to provide better attention to mothers and children, keep working on the promotion of healthy eating habits, and create more awareness on the relevance of food quality at all ages. And one challenge that we have is also to offer and to promote healthier food and allow access of healthy food in the food deserts that we have identified here in Bogota. So thank you for your time and thank you for this opportunity to present to you what we are doing in our city to overcome this situation. Thank you.
Thank you ever so much, Sarah. That was extremely enlightening, and I think it brings it back to us all how both climate change and the pandemic is a combined challenge, but also very interesting perspective on how you are tackling all of these challenges. I'll get back to questions and answers when we have been through all of the 4 presentations. To you as participants, I will tell you we had some internet problems here, and unfortunately, Sarah, we couldn't see your slides because the line wasn't working properly, but it will be available to you later. So don't worry, we'll catch up, and we heard every word of what you said. So we got that with us into the question and answer sessions a bit later. But I'd like first to proceed to this next presentation by Dr. Andrea Caracostas. I hope I pronounced it right, otherwise you must correct me. And we're very much looking forward to hear how the Hope Clinic is engaging in preventative health and how the role of Bite of Hope is what is playing in tackling food insecurity, and also what are the challenges. Now we heard the challenge from Bogota. What are the challenges you're facing in Houston, and also what has the Foodscape work added to your understanding of the local food challenges? And that's a lot of questions, so I'll pass it on to you for your presentation.
Yeah, good morning, everybody, and thank you so much for the invitation to share some of the work that we do at Hope Clinic. I will share my slides now, and I hope you can see them correctly because I can't. Let's see, around this. Okay, here we go. So now we've been working with Gehl for a long time, really learning from their model and trying to improve our services and really trying to be a clinic beyond the clinic walls. So Houston, real bit fast description of what Houston is and what we are. We really are a very diverse city and a melting pot. And so quick words about Hope Clinic. Hope Clinic was first started in 2002 as a volunteer 4 hours a month clinic, and really to address the barriers and challenges that Asian Americans had in accessing health and bridging that language barrier that they have. Hope Clinic grew over the years, and we became a federally qualified health center, which is a designation that clinics like Hope Clinic receive when they have quality outcomes and high quality care, as well as provide access to everybody regardless of their ability to pay. So Hope Clinic has grown over the years from those 4 hours a month to now we have 4 locations, over 200 staff. When I joined in 2007, we had 5 staff and a budget of $700,000. Now we have 4 locations and a budget of $21 million. We provide all services from 0 to 100, including OBGYN, family practice, pediatrics. We have a robust psychiatric department. We also deliver our own babies, and we have dental and vision. So as you can see, as one-stop shop. So we provide services to very diverse population. We provide care to people who speak 60 different languages, and we birth about 1,500 babies every year, and moms come from 90 different countries. So quite amazing cultural diversity. So this is a little map of our population, and you can see there is no real majority, although we have a big percentage of Hispanics in 2020, largely because we expanded one of our locations to a very Hispanic neighborhood. And you can see that over the years, our reach has grown from 5,000 patients in 2012. Today, we serve over 23,000 people. We provide 150,000 patient visits every year. Important things for you to remember is Houston is the 4th largest city in the country, and it is the most diverse city with no racial majority. Hope Clinic provides 150,000 visits to this very multicultural community. And another interesting fact is only 12% of all these people in this big city have access to food within walking distance. Some of the ambitions of Hope Clinic are certainly that we produce long-lasting impact in our communities. We learned from Gehl's walkability study several years ago, and now with the Foodscapes, that we need to bridge that indoor-outdoor gap by bringing people the park into the parking lot. This Houston being a very, very car-centric city. We also undertook, we're right now in a construction mode. We just finished a capital campaign for $30 million investment in a new clinical facility, which really is a testament to what we have learned from Foodscapes and from walkability studies, integrating their indoor and outdoor and moving the clinic really physically and literally outside the walls. Our work as a healthcare provider has really moved from the exam room into really upstream healthcare management, understanding that health is much more than just healthcare services. So what did we learn from Foodscapes, from doing our working with Gehl and the Foodscape? We learned several things that Jeff already mentioned, and certainly that in Houston, most food experiences in Houston are car dominated. Just drive-throughs or driving to the restaurant, getting takeout and driving it back home. That people have really, in Houston, people eat a lot out, whether they take out or they go into the restaurants. However, people are really missing out from being a long time out in a public space because there really isn't the amenities to walk around the public space or walk from home to a public space. The quality of the city is just really not built out for pedestrians. There is very limited sidewalks. If there is sidewalks, they're in bad shape, and there's really lack of shade. Houston, yesterday, September 21st, the start of fall, and it was 100 degrees. And you can imagine that walking under those temperatures is not the most pleasant thing in the world. And the lack of activities, recreational activities, certainly lack any kind of food amenities. While there's plenty of green spaces in Houston, believe it or not, they are designed for people to actively go for a walk or run, but there's no investment in them to keep people in the park beyond their physical exercise, if that's what they decided to go and do in the park. This graph here is I want to show you is a picture of our new facility and how we have really involved and put our money where our mouth is, like Jeff would say, in bringing the outdoors inside and the inside outdoors. So we have built a facility that has the shared community space where we will be hosting events, sharing them with the community, doing farmers markets and activities that will help our patients not only engage in their clinical care, but also engage in socializing and learning new behaviors and perpetrating those behaviors, because a lot of our patients actually do walk to our clinic. And you can see that we will have a space for arts in artist wall where people can actually do murals. They will have active in spaces where people can have a book fair or a food fair or just simply recreational activities. This is a picture of two children taking a food class chaired by our Chef Joe from our Bite of Hope program. And yes, Hope Clinic has its very own chef. And I think that the activities that we've had with Foodscape really helped us imagine a different universe, a universe in which we are much more connected. And food is the great connector. Everybody eats. Food and disease are, I always say, they're the great unifier, the universal language. Everybody eats the same way and everybody gets sick the same way. There has no socioeconomical should have no socioeconomical barriers. However, of course, people who are wealthier get better health and eat better, and the same for eating. So as a healthcare provider, we're really trying to bridge that gap by again, educating children early on how to prepare food, how to eat healthy, be creative with their eating habits, as well as educating our own providers on how to educate patients about eating better. For the longest time, we've been telling, give instructions on people how to eat. You don't eat well, you should eat this way. This is the number of calories you need to consume. And now we have shifted our mentality, and we have a chef, and the chef says it shares a meal with the patients. He runs cooking classes, and rather than telling people how to eat, he shares the cooking experience, which is so much more than just nutritional elements going into your mouth and down your digestive tract. It is socializing, it is culture, it is sharing, and it is a gap for addressing loneliness. So what are the long impacts, and what are some of the long-term transformation programs that Hope Clinic has? Certainly, the Foodscape has set an agenda for community transformation that we did not have before, and provided a long-term and sustainable plan for change. We now understand that as healthcare providers, we need to be deeply involved in urban planning, and because that is the way we will keep our patients healthy. We're also really involved in making sure that those shared spaces are actually dignified. People should get, world-class care, and they should have access to world-class parks. And lastly, I want to, say yes, data. Being able to quantify and measure how people eat, where they eat, how long they spend in the public realm has been really an important tool for us to sell our project, to sell our vision, and to implement change. So what is our strategy? So really, strengthening a Bite of Hope program by making the culinary experience so much more rich and visible, working with the restaurants that are around the clinic. And just full disclosure, Hope Clinic is in the middle of Asia Town, and there's 200 restaurants around the clinic service area, 2 miles around the clinic service area. So we really have a lot of restaurants, yet a lot of them, while access is great, the food is not the most healthy. So we've been involved for the last 2 years now with support of Novo Nordisk in creating a leadership program where we actually engage small business restaurant owners, underserved restaurants, in being healthcare champions. We actually empower them and show them that they have the power in their hands to change how the people that go to the restaurants eat. And in return, we provide them with e-commerce strategies. We market their restaurants. We review and help them and teach them how to manage their books. Also, how we revise their menus to help them transition from sweets to healthier sweetening options, from starches to healthier starches, portion sizes. And then we brand them with the Hope Clinic logo in an effort to, at some point, have our providers prescribe actually food from these restaurants and increase the foot traffic. Again, we are involved deeply in community development, and community development has to do also with the wealth of the community and their capacity to create sustainable, healthy businesses. We are also very aware that we need to improve mobility, and we've been working with the city of Houston really in addressing the challenges and educating the city about the challenges that our communities have in accessing healthy food options. Right now, Hope Clinics by the Hope program is supported actually by the county, Harris County, where Houston is located, to increase the number of healthy restaurants options for different communities. So some of the some other activities and suggestions that Hope Clinic has in mind doing a night market, given the nature of our community, which is heavily Asian communities are very used to having night markets, and night markets are perfect for Houston given the weather. You know, I just talked about the 100 degrees weather, and you don't want to be in the market or sell food under those heat conditions. So having evening markets where it's fresher to go out and gather would be a really good option. And then again, you know, bringing back the park into the parking lot and transforming some of the many parking lots that we have around the clinic into places where families can spend time together, and also bringing, you know, food options into parks where people go do their exercise but don't spend any more time than needed. Our plans, certainly, you know, we're studying participating in the Healthy Food Challenge and working with the city and other stakeholders to help create walkable opportunities in our city. We are very much a part of Changing Cities Diabetes and have been part of this program for many years. And we're very grateful for all their inspiration and for the inspiration that we've gotten from around the world. I think it is programs like this that allow you to exchange ideas, to copy shamelessly from very successful programs around the world. And with that said, we're very open to sharing any of our programs with you, any of our blueprints, and we're of course will continue empowering the small businesses through education and sustainable opportunities for business owners that are committed to providing healthy eating options for our population. The next steps, this is a picture of one of our classes. We are partners with one of our school districts, and we provide after-school classes to the during COVID. What we do is we provide the families with a full box of produce, and then they go home with their box, and then they mom and or parents and child participate in an online cooking event with the chef, and it is just a fantastic scene to be able to see the parents and the children really cooking together and enjoying, partaking in food preparation. Of course, the most delicious consumption of that meal. I really, we have involved a lot of people in this project, the school district, the county, the city, and several of our philanthropists. And we have also involved the insurance company. So insurance providers serve, are a big part of our healthcare network in the United States. And our Bite of Hope program has been funded by three different insurance companies to provide cooking classes and to seniors as well as to children, and just really teach people how to eat, not from the preaching provider point of view, but actually from the preparation and creative point of view. That's all for me. I really thank you again for your attention, and I hope I kept the time going. So that's all. Thanks.
Thank you ever so much, Dr. Karokostas. That was extremely fascinating and very interesting to see how you're putting the Gehl model into use, as you talked about earlier, and how you're using the clinic beyond the clinic as a way of making these community transformations. So thank you ever so much. I hope to get back to you later with some questions. There are some questions coming in, but we're a little bit behind schedule. So I will move on now to you, Selva Gurdugan. And I will actually give you the word straight away with no further ado, as we're a little bit behind the time schedule. So over to you.
Thank you so much. Can you see my screen?
Yes, I do. You need to get it up.
And just check the slides are moving as well, right?
Not yet, no.
No? 1 second.
I think you still need to get up on full screen.
Do the slides move?
No, not here.
Okay. What can I do?
They're moving.
Now they're moving, yeah.
They're moving, okay.
Yeah. Yeah.
Okay, so maybe I won't take it into full screen. Maybe that seems to be a problem.
Yeah, it would be good if you could take it into full screen. It's not there yet.
Does it still move when I move it into full screen?
Yes.
Yeah,
okay,
that
perfect.
is. Yes.
Thank you so much. All right. Thank you for inviting Superpool for a presentation today. It's quite an honor to be a part of this panel with such inspiring projects. We are an architecture practice based in Istanbul and Copenhagen, and our work has been, we've been practicing for 15 years. And one of the key questions for us has always been to think through what is the architecture of generosity? How do we create cities, environments that actually help us be generous towards each other? And participation does become a key question in that. But I'd say I keep it as a question, because participation seems simple, but it's actually quite, I think, complex, because is it participation in creating knowledge? Is it participation in actual design? Or is it actually participation in incubation livelihoods? So I'll kind of walk you through some of these learnings from the past 15 years in our practice. And the project that I will like to run you through is Urban 95. Some of you might be familiar with this project started by Bernard van Leer Foundation, looking at the early years in a children's life to see what can be done differently. If you were to look at the city from 95 centimeters, which is the height of a healthy 3-year-old, what would you do differently? So this is a question that is posed to different administrators, from city officials to NGOs to academicians to...
Excuse me, your slides is unfortunately not moving again. Could you try and activate them?
Right.
Yeah.
Does that work?
Yeah.
Okay.
Yes, now it's working again.
Okay. Okay, I'll keep it at this. I won't go to full screen. Seems like there's a problem there. So looking at the city from 95 centimeters, this is a kind of backstreet neighborhood in Istanbul. Of course, there's a lot to improve. And why is this important? Many of you know developmental stages, and the early years are the most crucial in a human's life, when our brain actually develops the most. So the healthy interactions at that time are as important as the nutrition that a baby is getting. So this project has brought together multiple partners, some of them like Gehl, of course, very important in structuring the urban thinking behind it. And again, I had posed 3 questions. How do we start thinking about participation? What we have learned is actually part of it is to learn to build a shared language and create knowledge together. And this has been very important in the work we have done with Urban 95, because participation, we always think about it as participation of the other. But actually, I think participation is mostly within institutions, within ourselves. We need to develop these languages and the sort of the baseline that we need to work off from. So classical tools like maps, we have heard a lot about data collection in the earlier projects as well. are very crucial to create that baseline. So here you see a series of maps developed by one of the partners in the Urban 95 network to look at the city and identify where the most children with the economic backgrounds are. So here dark blue means poorer children with also more numbers of children. So to try to see if the services that we are planning are going in the right places. Sometimes communication between different agencies within the municipalities and different NGOs, etc., who are involved in a project, do not always have the same criteria, same approach. So first, I think key for participation is setting up these data baselines. The other tool we have used a lot is for participation and developing this common language is Imaginable Guidelines toolkit developed by Chanel Architecture in Istanbul. This is a set of cards actually that touch upon key issues of urban design, and they can be thematically organized as well. So here you see cards about sun and shadow, tree canopies, some of the elements that actually make a healthy environment, and some kind of processes like CO2 monitoring or concepts like local identity and festivals and maintenance as kind of key components where when we start thinking about the design of a street, these are some of the many components that actually make it. But it's not always you have these priorities agreed upon among a group. And this could also, again, just be the city officials themselves or different agencies that are coming together before even we bring it out to a kind of bigger community group. And how we play this is that there's a role play sequence. So you are asked to change who you are around the table. So if you're a designer normally, maybe you become the real estate developer, or you become the little shop around the corner, and then you try to kind of think through what are the pieces that are important for you, and these cards kind of guide you in the different topics that could be of interest. And we have worked a lot within the Urban 95 framework with especially working with streetscapes and changing streets, allocating more space for pedestrians, and also incorporating play streets, etc. And all of with these programs, we make sure that we meet together with the communities to work through kind of play this game and start identifying what are the priorities that they have to create the design brief together. But as important as creating the design brief together is, I think, actually doing the implementation together is important. So we have worked together with Naktoji DCI from New York on transformation of a public square in Istanbul. And this process, again, is important to do it as lightweight as possible, in our opinion, because when it is done with just paint in the beginning, even when you bring all of these people together for that very simple implementation, it still is open-ended. And that open-endedness is, I think, very important in terms of both communicating possibility of change, possibility of things not being set in stone, and also possibility of participation in the process. So these interventions last about are done in a week and last about 2-3 months, and the city uses these also as opportunity to collect data, kind of do surveys, and get one-on-one response from the community. And for me, this is kind of the let's say the key experiences in my career as an architect is to be on the ground, implementing things and receiving feedback as things are happening. And normally, obviously, things are subcontracted. The crews on the implementation site are professionals. But when you make it as tactical as this, as kind of simple with paint as this, then the city officials themselves become the immediate point of contact or kind of NGO groups like ourselves become the point of contact. And I think that creates a different sense of ownership, which is something that is very important if you want these places to be maintained after you leave, be loved after the project is continuing. And programming, I think, is a very important part of participation as well. That needs to be always highlighted. And it was very exciting in that sense to hear about the cooking classes in Houston. So this project won awards, became capital investment. So it's not anymore in paint. It's the city has invested for a permanent change. But again, it is one out of many, many places that need interventions like this. And again, going back to participation with the community, but also with the agencies that are tackling these big issues, big motivations for change, but then it's difficult to do it on the ground. How do we support those city officials? How do we do capacity building? I think these are all issues of participation between this time experts and city officials to think through. And I will mention one last thing, and this is an experiment that is ongoing at the moment in our practice, which is to run incubator within the Architectural Association School of Architecture in London, together with Civic. And the idea behind this work is to imagine how do we allow actually people to participate economically, because we have seen a lot of projects in this presentation as well. But what's the community? And sometimes the community participation becomes an accessory. Like, sometimes it needs to be really thought through from, I think, participating in the economy, especially economy of food, something that came up a lot in this presentations today. Many times when we start working with communities in London, we realize how the food is provided and how it's actually distributed creates many bottlenecks. And there's a lot of communities actually who are interested in starting their own businesses around food. This is not the only thing we look at in the AA unit, but it comes up quite often as an issue. So the mobile van that we talked about, that Jeff presented as a really good solution, is really a good solution. And I think community and different entrepreneurs, local entrepreneurs, are also interested in that as a solution. So we are working as an incubator, as a kind of group of students who are supporting these budding entrepreneurs in communities to help them do their business planning, sometimes fundraising, and help them with their branding, much like the Hope Clinic just described earlier. And sometimes it goes beyond.
Selva, we need to wrap it up soon.
Services. Yeah, this is my last slide. Yeah, I know I'm
Fantastic.
at 12 minutes exactly.
It's fine, don't
more or less. Yeah. Yeah. So again, there's top-down and there's also grassroots, and I think we need to put all our heads together to figure out what are the methods of participation we should create to achieve these goals. Thank you so much.
Thank you ever so much, and sorry for hurrying you up here at the last moment, but we're running a little bit out of time. I can see questions coming in, and I would really, really love to take some of those questions after the last presentation. But last and not least, Sophie Quist, we very much look forward to hear your presentation as well, and then we'll take a round of questions after that.
Thank you so much, Judith. I'll just share my screen. Bear with me for 1 second. Excellent. Are you seeing that?
Yes, we are indeed.
Fantastic. And hopefully those slides will move again. So thank you so much for inviting me along, and thanks so much to all the other speakers for the really inspiring presentations. I'm Sophie Quist from Nourish Scotland, a Scottish food justice and policy organisation, and we work to integrate, democratise and localise food in the Scottish food system. And my contribution to today's important topic of creating food landscapes that are healthy for communities and for the planet will zoom out a little bit from the neighbourhood level and focus on local or city level or even subnational level integrated food policies, and this question of why food and local action should be at the heart of the global response to the climate emergency. And then I want to introduce an initiative that we, as Nourish Scotland, have launched alongside more than 60 local governments and city networks, and that's the Glasgow Food and Climate Declaration. Excellent. Are the slides changing all right? Hopefully. It's quite well known now that food systems, the way we process, produce, distribute, consume, and waste food, account for 1/3 of greenhouse gas emissions and cause up to 80% of biodiversity loss globally. This globalized industrial food system is degrading our environment, increasing emissions through deforestation, the overconsumption of meat in certain regions, heavy use of chemical inputs, carbon-intensive processes, and through loss and waste. And simultaneously, as we heard from some of the other speakers as well, climate change threatens the ability of food systems to deliver good food for all. And these adverse impacts are already experienced around the world. However, we also know that transforming our food systems hold the key not only to reduce greenhouse gas emissions and mitigating climate change, as I think you outlined at the very opening of the session, Judith. In Denmark, the huge emission reductions could really be located in the food system. But food systems transformation also hold the key to creating more resilient communities. Transforming our food systems would deliver critical co-benefits for biodiversity, livelihoods, cultures, socioeconomic, racial and gender equalities, and not least for health. This requires a shift to food systems that not only emit less, but also support diversity of crops, of diets, of animals, and of people, are circular and recycle nutrients, support equalities through equal access to good food and for fair livelihoods, and that, very importantly, value food as more than a commodity, but as something that's integral to well-being and to planetary health. So how can we achieve this? A key element and starting point for sustainable food systems transformation with these co-benefits for climate and for health is governance. And today, our global and local food systems are often undergoverned or governed in silos with responsibility for parts of that system split across several ministries or departments that set their own policy objectives. And this can lead to inconsistency and inefficiencies, and sometimes even to conflict between different policy objectives. For example, when food and drink economic strategies rely on exporting carbon-intensive food products, while climate plans in other departments are setting targets to reduce greenhouse gas emissions that do not include food. On the flip side of that, integrating food policies across sectors, environment, climate, health, social security, education, urban planning, as we've heard today, rural development, to name a few, can really help unlock policy synergies that help deliver on climate and health policies and many other objectives. And in fact, when integrated, food policies can help address all of the sustainable development goals, as this diagram illustrates. The blueprint for this kind of integrated food systems governance already exists. Subnational and regional local governments, including indigenous peoples and communities around the world, are already leading the way by adopting sustainable and cross-cutting food strategies and governance mechanisms that help shape healthy foodscapes and healthy food environments in cities and at the local level. And over the past year, we've been working together with the International Panel of Experts on Sustainable Food Systems and networks of local governments to highlight this work ahead of the climate conference that will take place in Glasgow later this year. And this has been a really inspiring process. And today I'd like to share a few examples of what integrated food systems governance looks like at the local level, as well as the initiative we're launching for COP26. So starting with Glasgow City, who will host COP26 in just over a month from now. In June this year, Glasgow launched its integrated city food plan, which aims to tackle 3 interrelated objectives. That's equity, sustainability, and health. And that addresses long-standing challenges of household food insecurity and obesity, in addition to climate change. The aim of this plan is to achieve a food system that is fair, resilient, and environmentally sustainable, and which enables everyone to eat healthy and affordable and culturally appropriate food, regardless of their age, identity, and circumstances in Glasgow. The plan includes 76 joined up actions across 6 themes. That's food procurement, food poverty, economy, children, the environment, and community food. And the implementation of the plan is overseen by a Glasgow Food Policy Partnerships that brings together people across the city government, public health, social care professionals, community food organizations, and other key stakeholders in the city. And all of these 6 themes have actions that relate to the environment and climate, and these include increasing the land available for food growing within the city, so setting up urban farms and linking those to food availability, and particularly in poorer communities, increasing the availability of and demand for agroecologically grown food and involving people in that process, creating jobs simultaneously, increasing the proportion of locally sourced and low carbon produced food in public sector catering, so that links up to the other objectives, and engaging with food businesses and restaurants and the public, learning around food waste and seeing how that can be reduced across the city. And then finally, also including sustainable food and curriculums in schools and colleges. And something that's been really interesting working with Glasgow and seeing this process is to see that the starting point for achieving this integration in the plan, which is really quite impressive in all that it tries to tackle, has been an inclusive and participatory approach. So something that starts with bringing diverse actors across the city together in a food partnership, but then also launching a year-long consultative process so that the outcome is really something that is owned by the citizens of Glasgow, even though I know that this has been difficult during the pandemic as this was done in 2020. But this was still a process that was really key to ensuring the integration of the plan. Leading up to COP26, I know Glasgow City is working with Sao Paulo, another city we've been in contact with, who also has a great story to tell about integrating food, health, and climate objectives. In the city of Sao Paulo in Brazil, Connecting the Dots is an initiative that started in 2016, initially in the city's urban development, economic, and environmental departments, and since other departments have gotten on board. And this really started with wanting to protect the water in the city from uncontrolled urban development. And what the city did was integrating this policy so that it has threefold objectives by investing in farmers in the rural part of the city in the south to transition to agroecological organic production. And then simultaneously, that would help increase food security in the city by supplying local organic food. And this is then linked up with a circular economy initiative that recycles food waste from parks and from markets in the city to farmers farming agroecologically. And again, a key to these kind of integrated outcomes that tackle food security, health, and climate and environmental objectives is integrating, but this time within the city, of having different ministries and departments working together. And finally, another example I'd like to highlight is the city of Bruges in Belgium. It's not always enough to achieve this kind of horizontal integration across different ministries at the subnational level, because while local governments hold many levers, they also need the national and regional governments to create enabling policy environments. And then on the other hand, local governments supply this, they can close this gap between the citizen and the policy level that other speakers have talked about. And Bruges is a great example of this kind of vertical integration between the regional and the local level of food governance. Bruges has done something that's, I think, quite inspiring, which is achieving a consensus in the city food policy mechanism on less and better meat. And one of the ways that they did that was by getting people around the table, in particular by including farmers in that policy making. But a way to achieve that is working with the region and the rural parts surrounding the city by involving the West Flanders government in that decision making. Another key enabler of being able to have this farm to fork strategy and an agreement on transitioning to more sustainably produced but less meat consumption was having leadership from the West Flanders regional government that adopted, I think, in April 2021, a Green Deal that mandates a shift to vegetable protein from animal protein. And having that policy at the regional level was a key enabler for the city to internally, we need to really work on this. We need to to follow this policy environment that's being set at the regional level, but also the city being involved, they were able to include the citizens and have them feel ownership over that decision as well. So something that all of these examples have in common is that they're signatories of the Glasgow Food and Climate Declaration, which is what I want to spend my last time, and I'll try and stick to it to get onto. So the Glasgow Declaration was drafted by the International Panel of Experts on Sustainable Food Systems, Nourish Scotland, and several local governments last year, and will be presented officially at COP26 in just over a month's time. And at its heart, the declaration is really about putting food on the climate agenda and calling for integrated food governance. It has 3 calls to action. That's developing and implementing integrated food policies and strategies, reducing greenhouse gas emissions from urban and regional food systems. And then it's a call on national governments to establish and support policy frameworks and multi-level and multi-active governance mechanisms that enable subnational governments to continue this incredible work. So far, 60 plus subnational and regional governments across 5 continents have signed the declaration. And I want to finish now on a call to all national governments who are listening in ahead of COP26 to consider endorsing the Glasgow Food and Climate Declaration as well, and moving food up the agenda in the international climate negotiations. Thank you so much.
Thank you ever so much, Sophie. What a great note to finish on, both an encouragement and also looking at your impressive approach. We're running a little bit out of time, but I do want to take a number of questions now, and I'll take we do indeed have had 4 different presentations, so the questions are a bit pointed at different ones. So here comes from the very beginning a question from Paul Black in Copenhagen. He asks citizens, or state, I guess, citizens are consulted, professional take decision. What if that was turned around the other way for the purpose of fostering community empowerment rather than service provision? And I guess in many ways that goes all the way back to our 2 first presentation. Is there one of you who want to give an answer on that? Do we still have you with us, Sarah?
Hi, yes, I'm here.
There you are. Now I can see all of you. Wonderful. It actually feels like having a panel here. Absolutely fabulous. So I guess this question goes to a couple of you. Sarah, what do you think?
Can you repeat, please, the question for me?
Yes, I guess you can't see it here. Generally, the question is about when we look at this citizen involvement and public participation. I can pose it to all of you and raise your hand if you want to answer first. But really, it's all about do we have the right approach when you actually start by consulting citizens and then the professional takes the decision? Could you reverse that so it's more citizens that are part of the decision making?
Yeah, so definitely at the city level, perhaps we didn't deep into that participation as my other colleagues did in their presentations, but citizen participation is fundamental. So for example, here in Bogota, we have called these participatory budgets when citizens propose their own initiatives, but also raise their awareness on the questions that they have also on they can work actively, not just in the proposals, but also later on in these solutions that we have. And also in the food activities, perhaps we have some examples with urban food production, where we are engaging with communities. We are working with our botanical garden with them, and they have a lot of wisdom and knowledge about food productions, and we are engaged with them. So we are creating with the communities these activities. And they participate and they propose and they know more about the local dynamics, so they can get engaging. So as a public government, we have to listen to them, but also build with them the solutions, because they are the ones that know the needs on the community. So perhaps my colleagues can deep into this.
Yes, is there any further perspective on this question? Yeah.
Yeah, I think maybe an interesting tool is microfinancing options. And when you ask Jeff what his dream would be for a decision at the end of these panels, I think would be interesting if also different microfinancing models can be implemented for food production across different communities. I think that giving tools and giving budgets back is important, because decisions come with budgets.
Decision comes with budgets. Yes, I guess that was Jeff also was the big wish for the outcome of this summit. Thank you very much. I move on to another slightly more methodological and technical question about Foodscape, which is what today is also all about. And there's a question here coming from Auckland, New Zealand, from Jaresh. And it says, I undertook an urban design study on Foodscape in lower socio-economic suburbs in Auckland, in New Zealand, and finding strong links between sensory exposure to the formation of food choice habits, such as sense and smell. In your research, did this qualitative information come through, particularly in your work with youth? Is there anyone who can answer this question in any of your methodological work with this? I guess we're coming very much down to methods here, and really I would very much like, Jeff, are you with us still?
Yes, I am.
Okay, I think this is a method question to you, really.
Yeah, I mean, I think I moved outside though. I mean, I think that the method that I would really emphasize would be this notion of community researchers and sort of community experts, and making sure that we make it as easy as possible for folks that are expert in a certain location to be able to have the vocabulary and the means, whether that be digital or the format, to really express their knowledge and expertise. So to me, that's like a very personal, very human method.
I think it's a great method. I think this question is all about, I think while I'm pointing at you a little bit, is the project you had in Copenhagen, which was really fascinating, how you actually got used to change the habits by actually looking at their values and their preferences and how they move through the city. And I think this is more sensory question. Did you actually look into any of the sensory exposures that was relevant on that route, or was it other aspects that made you shape this project?
Yeah, I mean, I think, again, by just going in with this idea that the community group is the experts, some sensory elements came out, but we didn't really force fit it, right? They said things about colorful, should be colorful and playful. And the kids mentioned like the ability to sort of move furniture and take ownership, and be able to be together in a tight-knit sort of seating arrangement where they could be 2 friends or 10 friends, and the environment kind of responds to that. So some sensory elements certainly came out of it. I think the key is maybe too narrow to just be 100% sensory. But if we're really listening to folks as experts, then there'll be sensory elements, there'll be safety elements, there'll be financing elements, there'll be all sorts of things that we can become wiser.
You can actually recognize some of this that we also see in Auckland, New Zealand. Thank you very much for that question and answer. I'm actually running out of time, and I have 1,000 questions, and I also have a lot of wrap up. I have so many learnings from today. I hope that goes for all of you as well. I just have left to say thank you ever so much for spending your time with us today. And then for a closing remark, I'll give the word to the Associate Director, Anne Gadegaard, who will also tell you about the next step from here. Thank you ever so much. Right. I'll just spend the last minute. First of all, thank you for investing your time being here today, both the panelists and also the ones who have been engaging with us throughout the last 2 hours. I do apologize for the technical glitch. The technical guys have promised me that we can build in the presentations into the remarks, so we will be able to make a full recording available in approximately a week's time. So that will be out there. If there are any questions, please connect and we will answer this. And just for another next step, we have actually committed together with, and the Royal We here is Novo Nordisk, so together with Gehl and the Seno Diabetes Center, what we will do based on the conversations today and the Foodscapes work that we have been making, we will make a toolkit that we will be making available for the world, so everybody will be able to work in a participatory way to develop Foodscapes analysis, to build policies, to engage with your local authorities in terms of finding a way where we can actually create healthy food landscapes. Thank you. Take care. Have an amazing morning, day, evening, wherever you are. Check into the Food System Summit tomorrow and see what is coming up in your part of the world. Thank you.